Hello, and welcome to Healthy Hernando. My name is Ann Gale Ellis. I'm a health educator with the Department of Health here in Hernando County. Thank you for joining us today. I'm really excited about today's topic. The topic is the National Kidney Foundation, kidney disease, kidney transplantation, and just some general questions about some kinds of chronic disease and transplantation. I'm excited that Mr. Joe Caron, who is a patient advocate and educator with the National Kidney Foundation, and he is our area representative here in the Nature Coast area. He is with us. He is also a double kidney recipient, transplant recipient, which makes you probably one of the most knowledgeable people on this topic. Also, we have Mr. Robert Rosser. Mr. Rosser is a donor, a kidney donor, and also a volunteer with the National Kidney Foundation over in the Orlando area, and he's driven all the way over here to be with us today, so I'm very appreciative for both of you to be here, so thank you so much.
You're welcome. Thank you.
As with most of our programs, I'm just going to sort of throw the discussion out there, and we'll just run with it, and we may get off on a tangent, that's just fine. If it gets too long, you either need to bring me back or I'll bring you back, and we'll try and get as much information as we can today.
Okay.
I know, Mr. Caron, or Joe, that you cover Hernando County, but you are interested in having a little bit more, being a little more visual in our community, if I'm not mistaken. I think you told me that just recently.
Yes, one of the problems that we have with kidney disease is the lack of visibility. And when we go county by county and reach out to the residents of that county, we're able to concentrate that information on a smaller level so it gets taken in, instead of trying to do the entire state of Florida at one time. So we feel that it's much more effort, but the results are going to be much better.
Well, and I met Joe recently at a health fair, and I was thrilled. I worked for a nephrologist for a number of years and had no idea that you or somebody like you was available right here in our community. So I was very thrilled to grab onto you and say, let's talk, let's talk. And then I was even more thrilled when I heard your story. So what I'd like to ask you to do right now is just tell me your story, or tell the audience your story, and let's get a feel for how you got involved in the National Kidney Foundation.
Okay. In November, years ago, my son got married on a cruise ship, and we went on that cruise, our whole family, and I wasn't feeling well. But I wasn't going to, not be there for my son, obviously, so I trudged through it. Within 24 hours of the end of that trip, I was in the hospital and having dialysis. The only indicator I had was I had some protein in my urine, which is basically blood in your urine. It wasn't visible, it's microscopic. And I had people who kept telling me, physicians, that, we'll keep an eye on it, we'll keep an eye on it. And then I started developing some other problems that were not indicative of any disease I've ever had or any malady. And I got kind of concerned about it, not enough to do anything about it, unfortunately. Because other than that, I felt good. I didn't have really any symptoms besides what a lab would show. And since I'm not capable of doing my own labs, the only time I saw it was when I went to get labs done, once a year or so. Come to find out that the protein in my urine was because my kidneys were bad. And they were both bad at the same time, all the way through. When I was finally diagnosed, I had less than 7% kidney function in both kidneys. So that's why I was on dialysis immediately.
Now, for those folks who don't know what dialysis is, can you give a layman's description of what dialysis is?
Sure. Let me give you the mental one first. It's like carrying a 400-pound elephant or 4,000-pound elephant on your back. You're controlled by a machine. The machine filters the fluid out of your body and the waste materials out of your body, roles that the kidneys would do. And then you have a chemical regimen that goes along with that, because your kidneys are extremely important in regulating the chemistry of your body. So once you are diagnosed, the nephrologist usually sends you to a dialysis clinic. And there's many of them, many of them. They usually inform you of where to go and what time to go, and then you start getting your education. The biggest problem with going to a clinic is you're sitting there for between 3 and 4 hours a day, 3 times a week. As an inconvenience, it's a major one. As a treatment, it's marginal at best, because it just gives you enough clearance to survive. The primary function of dialysis is to duplicate or replicate what your kidneys would do. And you can imagine your kidneys run 24/7, and your dialysis gives you about 12 hours a week. So it's not going to make you better, because you can't get better. It's going to make you survivable until a better treatment comes along. But there are systems of dialysis that can be done at home where you can do them every day, or every night, or any time during the day you would like to do it. So consequently, instead of getting 12 hours a week, you might get 30 to 40 hours a week, which is much better, obviously. Mm-hmm. So that, the dialysis takes away pretty much your life as far as having flexibility in it, because you have to be somewhere every time, either every day or 3 times a week at a certain time. You have to get transportation to go there. You have to find your way back, mm-hmm. and you're connected, and you're getting fairly large needles in your arm to allow the blood to come out of your body, around through a filtering system, take the waste material off and the additional fluid off that's in your cells, and then come back into your body as clean blood.
But the wonderful thing about dialysis is
there's
no other option.
Yeah.
Right. I mean, other than transplantation, which we'll get to in just a minute, which
right.
unfortunately isn't available to everyone. Dialysis does allow a patient with chronic kidney disease whose kidneys aren't functioning, it does allow them to remain alive, correct?
Yes. Kidney disease comes in 5 stages. You would actually be on dialysis in stage 5. That's when and we'll go over this in a little while, but it's called a GFR, which regulates the ability of your kidneys to cleanse your blood and how well they're working. And if that is 15 or below, you're going to be on dialysis. A normal healthy kidney would be 100. Mm-hmm. And then you work your stages down from there. Mm-hmm. The important thing is that if we find your disease in stage 1 or 2, which is difficult, we can do a lot to maybe never have you go into dialysis.
Mm-hmm. Okay, I want to back up just a minute.
Okay.
You said you didn't have any real indicators except for little protein in your urine on lab tests. Mm-hmm. Is that normal for people who are moving into a chronic kidney condition, that they don't have any warning signs, or normally you have some warning signs?
Yeah, with education comes earlier detection. And if we can get potential patients to do an additional blood test with their normal yearly checkups, that may give us a better indicator of where they are as far as kidney disease. Like I said, if we get it early, your chances are wonderful that dialysis may not have to be an option. Mm-hmm. But again, definite, visible, critical problems do not happen. They're not, unless you're discovered late, obviously in stage 4 or 5. Mm-hmm. But in the earlier stages, it may be some protein in your urine. It may be some blood pressure can't be controlled. Mine was that case. I had 5 different medications, and it was not being controlled. And we finally had a discussion right before I got diagnosed that maybe it's not the blood pressure that could hurt the kidneys, maybe it's the kidneys hurting the blood pressure. And that's what it turned out to be.
So your kidneys were causing your blood pressure
My kidneys
issues.
were causing the problem. I had what is called cystitis, which means that on the mouth of the bladder, little cysts grow and prohibit the release of urine. And it backs up into your kidney, and in your kidney are thousands of little filters called nephrons. Mm-hmm. And these nephrons, under pressure, either die, blow up, whatever word you want to use for it, they're gone. They no longer function. Mm-hmm. So there are so many different causes for kidney disease, whether it be chronic or end-stage renal, mm-hmm. That you just have to be very aware and just add a couple tests to help mm-hmm. be diagnosed early.
So I would imagine, I went on to the National Kidney Foundation website to become a little versed in the conversation we might have today, and it allowed you to take a self-test, you know, to kind of see how at risk you might be for being a renal patient or a kidney patient. And I was looking to see some of the indicators that might make me at more risk for having kidney issues. Now, you mentioned the blood pressure. I think I saw obesity, which it seems like obesity is an indicator for just about everything.
Comes with diabetes and blood pressure.
Yes, that's true. They all work together. African Americans, I saw, have a 3 times greater risk.
Just upgraded 3.5 times more.
3.5 times.
It's increasing.
Okay. So that's a population. And that's a population who also has an increased incidence of diabetes and high blood pressure as well. People with autoimmune disease have an increased risk. And people with family history, is that correct?
There are major signs of hereditary kidney disease. One of the most common is polycystic kidney disease, which is the most common kidney disease that's hereditary. And that is where tumors physically grow on the kidney itself.
Yes. Okay. So if you fall into one of those risk categories, it's a good idea. Obviously, you want to alert your physician that you.
Definitely.
Yeah, and so okay, that was some good foundational information.
Okay.
I want to come back to your story about your transplant situation, but I don't want Robert to feel left out of the conversation, so I'm going to move over here and give you a chance to get a sip of water. Robert, again, thank you for driving all the way over here today.
Thank you for having me.
You're welcome. You are not a chronic kidney disease patient. You're the other side of the coin.
Correct.
You
yes.
are a donor. Can you tell me a little bit about your story, please?
Well, my story started back at the end of 2013. My brother, at the time, my girlfriend's brother found out, or he knew he had kidney disease, but he didn't pay attention to the signs. He didn't know to ask his doctor during his physical, hey, can you please do the blood test for my kidney? And so it kind of creeped up on him a little bit. So about the end of 2013, his doctor says, hey, guess what? Your kidneys are failing. We have to put you through the process of starting dialysis, and you need a new kidney. Well, of course, my girlfriend, wife now, found that out and says, what can I do? How do I donate my kidney? And so at about, I want to say about February of 2012, or no, 2012, sorry, she did all the processes to become a donor. She stopped smoking. She quit cold turkey, because you have to be 3 months clean from smoking to be able to donate. Ran through all the tests, everything like that. We got towards about September of 2012 and found out that she could not donate. Found out that she had a different sort of kidney disease. She won't ever need a kidney, but she couldn't give her kidney to her brother due to that disease. And so after the phone calls to her family and her brother says, hey, the test didn't work out, it was very trying times, emotional times. We became best friends with our social worker at the hospital. This was all in Seattle, where he lived. So we were doing everything by mail and over the internet, and phone calls every day. And so she had the phone calls that night with her family, with her mom and her brother, and I left the room so she could talk, because it was pretty emotional. She came out and just kind of looked at me, and it kind of hit me. I was like, can I get tested? I'm not related. I mean, I know him, but we're not related, of course. So what about me? And so we actually tried to call the social worker that night. So Seattle being 3 hours behind says, what can we do? How fast can we do it? We didn't get a hold of them that night, got a hold of them the next day. I guess you'd call it fast-tracked my testing. Yeah. Went through everything. I was lucky that my wife had gone through it, so I knew kind of which clinics to go to, who to talk to, because you have to do urine samples and blood tests and things like that. So I went through all the tests and found out New Year's Eve of 2012 that I was eligible to donate to my brother-in-law. He became my brother-in-law at that time. Yeah. Once we found out, my wife and I decided we were going to get married, but just kind of pushed everything up that time.
Well, she better marry you after all that, huh?
Yeah. So found out New Year's Eve 2012 that I could donate my kidney to my brother-in-law. Of course, everybody was happy. And then we had to go through the process of finding the date for the surgery, get everybody me to Seattle, my wife to Seattle, her parents, relatives, anybody else that was trying to be there for the surgery to support us. And then March 5th of 2013, I donated my kidney to my brother-in-law.
Well, that's fabulous. Now, for those of us who have never experienced this kind of a situation, can you tell the difference that you're functioning on one kidney?
No, not at all.
And I assume he's doing very well?
Outstanding, yes.
Now, is he considered
He's not
recovered, or?
He's not cured, because the kidney disease, it's not a cure, but it does replace dialysis. It replaces that needle 3 times a week for 4 hours. That's what he was. He was in a clinic 3 times a week for 4 hours at a time, and he couldn't do anything. I mean, if his kids, he has 2 small girls. They just had birthdays. By the time they were under the age of 3, and his wife's in-laws lived on the coast in Seattle, and if they wanted to go to the coast for Labor Day, Memorial Day, 4th of July, he couldn't, because he was on dialysis.
Right.
He had to make special arrangements if he wanted to come home to see his parents in Florida. They both live in Pensacola. That if he wanted to see them, he had to make a special arrangement. If he could go on somebody else's dialysis center to do this and things like that. So it was just very inconvenient and very hard. And I watched it because they lived in a multi-story home, and dialysis took such a toll with his disease, he couldn't even carry his kids up the stairs.
Yeah.
And I
Wow.
saw that, and it's like, what that must be like. And he no longer has to worry about that. We were just there a couple of weeks ago, and he's running up and down stairs, playing with his kids, swinging, doing a playground, everything that a normal parent wants to do. And now he gets the chance to do that, and it's just an amazing thing. And
yeah, that's an amazing story, and for both you and for him. And congratulations, and thank you, and all the things that I should say. Let's take your brother-in-law's side of the story and go back to Joe. Now, Joe, your story is very different, I think. Maybe not, but I think. I've not heard of it. You got a double kidney transplant at the same time, right?
Yes.
Tell your story.
Well, halfway through my wait for a kidney, which was about 4.5 years, they came up with a new scenario. Previously, you had to be under 50 years old to donate a kidney. Then they did what they called expanded, and you could sign up for any age kidney. And I personally didn't want a 25-year-old kidney when I'm 63 years old. You know, that's the one thing that makes sense to me. So I opted for any age kidney over the age of 50, as long as it was functioning properly. So my donor, I had what they call, unfortunately, no, I'm not even going to use the word. Let's just say a deceased donor, because I don't like the word they use for it. That donor passed away, and I don't know the causes, and I've never been able to talk to them. So I don't know the whole story behind it. But I did receive a phone call on my birthday, March 25th, and the phone rang and it said, "Happy birthday." So I just said, "Happy birthday, thank you." And he said, "We have a gift for you." I said, "Well, you didn't have to do that." And that's when she said, she was playing with me basically, and she said, "Well, we did have to do it because we have your kidneys." Well, my wife, who's also works in dialysis clinics, after I got sick, I'm trying to point to her and talk at the same time on the phone. And she got it. It was very emotional. And, you know, you're always packed to go. You're always ready to go. It's
And
like
you wear a beeper, don't you?
well, it's a pregnancy. You know, you're except in reverse. You know, you're packed to go get something put in you, not taken out.
Yeah.
So that is, I mean, a very emotional moment. You get to the hospital. Very successful surgery, but the one thing that you really have to consider, and it hit me pretty hard, is that you're in your room celebrating with your family, and 150 feet away is somebody that lost a loved one. And that, I think, from the mental aspect of transplant and kidney disease in general, that's one of the tougher things to take in.
Yes.
But they did give me both of them because he was 66 years old. Don't have any idea what this gentleman did in his life, but I know he protected his kidneys because they're working wonderful.
Yeah.
And honestly, I thank him every day.
Yes.
Hopefully by doing what I'm doing today.
Now, how long can someone with a transplanted kidney, I mean, well, that kid, like, let's say you were 45. Could you plan to live to be 75 with transplanted kidneys?
We have kidney transplants that last 4 hours that die in surgery because they don't work right. We have transplants, the longest one is 50 years old. So basically, at my age, if I take care of myself and don't do anything to hurt my kidney, kind of follow a different menu path, if you will, I can be expected to have this kidney probably until I depart to wherever it is I'm going.
Yes. And you have a full expectation to live to your normal lifespan?
Yes, I do.
Yeah.
I can definitely do that. I don't know if I can do it financially because
Yeah.
I didn't plan on living this long, but I think I can do it physically.
Yeah. Now, do you have to do anything? I know you don't have dialysis anymore.
No.
Are you still a kidney patient?
Yes, you're always a kidney patient.
Okay.
There is no cure for kidney disease. It does not exist. Transplant is another therapy. Is it the best therapy? Yes. If you're physically able to receive a kidney and somebody else was physically able to donate a kidney that would fit into your body, I don't mean measurement-wise, but
right.
you know, the way your body's chemistry is, then yes, you can live full life expectancy. If in fact you don't take care of yourself, problems that you had before could possibly affect your new kidneys. And that's sort of sacrilegious if you think about it in the kidney community, to not take care of the gift you
Right.
got.
Well, and that brings to a question, like, for instance, who qualifies to get kidneys? Would a smoking person be eligible for a kidney?
There's a complete list of stipulations. First thing you do is you have to go through a series of tests. Everything from, well, you know, let me turn it over.
Okay.
Because the donor process.
Oh, the donor process,
Yeah.
yes. For me, it was. It started with general medical history. It was about 6 pages of questions they ask. They ask your family history, your history, immediate history. They even went into my grandparents. Went from there to the first was a blood sample. And they look for markers. It's what, 6 markers?
6 markers.
6 markers that they look for to match, plus your blood type. Your blood type is a must. Blood type has to be compatible. And mine and my brother-in-law's blood type did match. We ended up matching 1 marker out of the 6. Because with the anti-rejection medicine, with the technology they have with them nowadays, they were able to mix and match those medicines so that my kidney, or his body wouldn't attack my kidney, and my kidney wouldn't look evil to his body. So yeah, they did the medicines and everything like that, and we were 1 marker. So we did the blood sample, urine collection, checking to make sure my kidneys are doing everything that they're supposed to do and healthy, and I'm healthy. And the way the doctor explained it to me is that when we pick somebody that's eligible to donate, they are one of the healthiest people in the world.
Really?
Yes.
That's
I mean,
gotta make you
I
feel
would be the
pretty
first to
good.
admit I'm a little out of shape. I'm not a model. I'm not a fitness model or on a machine, and none of that. But as far as my insides go, I'm one of the healthiest people on the planet because I was able to donate. And that's the biggest misconception everybody has since I've donated is the education part. Everybody's like, well, I thought you had to be related and all this. You have to be like super matched. And I'm like, no, you don't. And then they say, well, aren't you diminished now that you don't have one? It's like, no. And that's why the kidney community uses kind of a tagline of share your spare. So that's essentially what it is.
Oh, I've not heard that before.
Yep,
That's pretty clever.
It's a spare. And they told me, everybody's like, well, aren't you limited to do this and not that? My doctors told me 5 things. They said for the next 2 weeks after surgery, don't lift anything heavier than 20 pounds. It wasn't for the kidney, it was for the incisions and the stitches and things. Don't do any contact sports for 6 months. And obviously we've seen in history that's changed. You've had Alonzo Mourning that plays basketball. He was a kidney patient. Eric Compton, he was a heart recipient, a professional golfer. So you can live a normal, active life after donation and after receiving organs, kidneys specifically. But other than that, they told me just a normal diet that you would to be healthy. Not a bunch of red meat. Make sure you eat the right proteins. Stay away from the salt. Stay away from the sugar. Everything you would normally do to try to be a healthy, active weight is what they told me.
Yeah.
Nothing different.
Interesting. Now, that was from the donor perspective, but my question is, who can be a recipient? Number one, is there a top age you can be? How young? You were just telling me a fascinating story about a mom who donated to her infant child. What does what are the parameters for receiving a kidney?
Well, you go through the same series of tests. You go through heart caths, you go through prostate exams, you go through urological exams, you have different types of scans. It's a whole process. I mean, it's a lot. And a chemistry. You go through blood chemistry all the way down. And you're not actually looking for the perfect match, okay? You're looking for a match that falls within the abilities of the anti-immune drugs to ward off any body fighting with the new organ going in. So as we get deeper and deeper, and I want to paint a story of optimism, because we're going deeper and deeper into the cellular structure to be able to find more and more drugs that will allow people to match even further and further apart. And that's going very well. I take 28 pills a day. Morning, a couple at noon, and the rest in the evening. And that's the smallest price that anybody would ever have to pay for life.
Now, are those all kidney-related medications?
Well, unfortunately now, kidney transplant can bring on some other problems. For example, most kidney patients take a steroid, chlorprednisone. Prednisone causes diabetes. The same thing that helps our kidneys is what you get from some of the drugs. And so we try to regulate how long you're on that and how soon you need to come off and what tests you need to run. So I didn't have diabetes when I started, I do now. That's supposed to last about a year or two. I'm 18 months in, so I'm waiting. Basically, it can cause high blood pressure, another problem with kidney disease. But that only hurts if it's uncontrolled. So as long as you're controlled, diet is changed significantly. It's changed when you're on dialysis. And then when you receive a kidney, it's the direct opposite. No protein, some protein. Don't eat this, eat this. No phosphorus, like tomatoes or anything else, eat that.
The bananas.
No banana, yeah. Now try to keep in mind that most people who have kidney disease have a few other maladies. Okay, so if you take diabetes, and you take high blood pressure, and you take kidney failure, that's 3 different menus, 3 different lists you can and can't eat. So basically what you have to do is you have to, hopefully somebody will write a program for this, but you have to put all the things you can eat and match them across the board.
Right.
All things you can eat and match them across the board.
And I know at dialysis centers they have dietitians on staff.
Yes.
Because I hadn't thought about that, but it's got to be a grueling process trying to establish what you can and cannot eat. Because some foods could be deadly to a person on dialysis.
Oh, absolutely.
Yes.
Absolutely. Any food with phosphorus in it, sodas. Sodas contain a huge amount of phosphorus. The only dark soda that is okay to drink occasionally would be root beer because it's natural. Most of the light sodas are okay, but there's other things to drink.
Right.
We don't recommend that you drink soda at all. We recommend that you go online. You can come to the National Kidney Foundation of Florida, which is, I think you're going to put it up. You can come to that and automatically go to the diets that are available, pull them down, and cook like that. If you need more information, you'll be able to contact me from the website.
Right. And actually, throughout the program, that we are putting your contact information on the screen so people can contact you. And I think one of the things that drew me to you when I just casually met you not too long ago was that you said, I am here 24 hours a day, 7 days a week for people who have kidney disease and they are panicking, they are nervous, they just got called, they just got diagnosed,
Absolutely.
whatever it is. And I was so impressed by that, and I fortunately, I don't know anybody who's going through that, but I would feel so comfortable in saying, I have got just the person for you to call, because it sounds like you can address questions not only from an educator and a patient advocate standpoint, but somebody who's been there, done that, and so I appreciate.
Keep in mind, we're not physicians.
Right.
Okay. Any information you get from us is based on for other patients, based on our experience. I'm fortunate, well, they're unfortunate. I'm fortunate in the fact that I speak to so many patients that there's a vast amount of commonality that goes through everybody's illness. And we're able to, patients like to talk to other patients. Patients like to talk to somebody who's been through what they're going to go through, can explain the financial issues, the relationship issues, the monetary issues, it's a complete
Emotional.
change of life.
I imagine,
Well, mental, to me, the mental was the most difficult.
Really, yes.
And I think that falls on everybody. Because all those other things that happen to you lead to mental also, plus the simple awareness that now you have a disease. But now let me say the good part, okay? Those are all the negative things. Here's the good thing. If you have to have a possible life-ending disease, you should pray to whoever you pray to and thank them that it's kidney disease, because it's one of the few organs we can replicate, maybe the only organ we can replicate safely, with dialysis to keep the patient alive long enough to get another treatment and a better shot at life.
That is a positive way to look at it. I have a positive story too, and I told you I'd try not to make this about me, but let me tell you, I have rheumatoid arthritis, which is terrible. But the wonderful thing is I just read a study that says people who have rheumatoid arthritis there's a decreased incidence of Alzheimer's disease. So I said, woohoo!
Okay, so where are we?
We're back here. We're back here to kidney disease. I'm sorry, I just had to share the example with you.
That's important.
Okay. All right. So I've got a couple more things I wanted to make sure to touch on my list of things I wanted to cover. I wanted to talk a little bit about paying for a kidney transplant. Is that something that's covered by insurance?
Absolutely.
Well, all of my expenses were covered by my brother-in-law's insurance.
Okay.
Now, mine was a little special circumstance because it was in Seattle, so I was responsible for all the travel and the lodging and things of that nature, but all of the medical expenses, through all my testing and everything, was all by his insurance.
Now, I'm assuming that a kidney transplant, the cost is astronomical. How does it compare with a continued course of dialysis?
Much better. To give you an idea, dialysis runs between $80,000 and $90,000 a year. A transplant runs between $1 and $140,000 and $140,000.
To do all parties involved.
To do a transplant.
Yeah.
Well, I really don't know on the live donor side. I have to plead ignorance there.
But even double.
I think total with his and mine, I think it turned out to be right about $200,000.
Okay.
Total.
But even so, in a little over 2 years, you've paid for it anyway.
You've paid for it.
Yeah.
Yes.
And when it's a deceased donor, then you don't have that other cost. You just have the surgery. I think my total was about $116,000.
And that was for 2 kidneys.
That was for 2 kidneys, yes. The surgery was much longer. It was about 7.5 hours.
Yeah.
But when you also look at the insurances and how they're covered, everyone who has paid into Social Security, okay, will have Medicare for this disease.
Whether
And
they're 40, even
matter.
if they're 40?
Doesn't
Okay.
matter. They automatically qualify for disability because it's a debilitating disease. So they have that going for them. If you have private insurance, your private insurance covers everything for 30 months. So that private insurance, whether it be Aetna, Blue Cross, anybody, will cover for 30 months. The deal negotiated by the Senate and the House was that after 30 months, Medicare will pick up those costs, which means that Medicare does the majority of the transplant cost coverage because most people don't get a transplant less than 30 months.
Yeah.
Okay, so, but at least it's a shared cost. It doesn't hit Medicare for everything. It doesn't hit the private insurance for everything.
Right. Now, I'm going to say this, and it's probably, everybody says, of course not, but I just want to make sure. You cannot pay for a kidney.
Not in the United States.
Okay.
Pretty much everywhere else in the world it's possible, but not in the United States. They're afraid of the obvious.
Yes.
Yeah.
Yes. Okay.
But I do want to bring something up since we're talking about the transplant disease. There are 26 million people in the United States with kidney disease. 1 out of 9.
Wow.
It's an epidemic. We have 110,000 people waiting for a transplant. In Hernando County, in Hernando County, or just on the border of counties that border it, we now have 8 clinics, dialysis clinics. In 2010, there was 1.
Wow.
They're not building these because they want big fancy buildings just to be sitting
Right.
empty. Okay, that's how quickly it's spreading.
Wow.
There are 19,000 people in Hernando County right now at risk, which means that they have high blood pressure, diabetes, hereditary issues, polycystic. They basically, the residents of this county have a 1 in 9 chance of being diagnosed with kidney disease. If you have diabetes and high blood pressure and you're overweight and you're getting older, okay?
And you're African American.
And you're African American, Hispanic, and don't leave out Caucasian because they get it. It's just that per capita, their numbers are less.
Right.
So if you took 1,000 African Americans, 1,000 Hispanic, and 1,000 Caucasians, Hispanics would lead by far. Okay, the number of people that would be diagnosed. The big deal is for those people is to get checked and to make sure that whenever they go to their doctor, they get checked through a blood test. We're also willing to put on, we know we do health fairs, but we're also willing to put on an actual health clinic where people can come in and get the test they need to see where they are. And just to give you an idea, we did one, we had 99 people there.
Wow.
11 people had different stages of chronic kidney disease, mostly around stage 3.
Wow.
Now,
Wow,
even
that's-
up to stage 4, okay, early stage 4, we can still elongate the time before you would need dialysis. If you're diagnosed with stage 5, I'm going to be careful how I say this. If you're diagnosed with stage 5, you're probably going to be in dialysis immediately, okay, if not sooner. If you're diagnosed in stage 4, it's probably a good time to start looking for somebody to donate their kidney to you. Kidneys last longer when they're family members.
Oh, that's
All the history goes to that. Goes to saying that that's the way it's going to be. You get a kidney from your brother, sister, mother, father, uncle, aunt. You're going to have a better chance of that kidney lasting longer.
And that's what they told me as well. Is that when my wife went through it, they were giving her odds. She ended up to be a 6-marker match, 6 out of 6, and they said that her kidney, before they found out about the kidney disease, would probably be about 25 years, 25, depending on how healthy her brother was going to be. For me, they said anywhere between 15 to 20 for my kidney, and
Right.
that was 1 marker, and and that's the big thing why I started after my surgery, why I got involved with the National Kidney Foundation of Florida, is that the amount of people that I met that had so many questions and so many misconceptions about organ donation and said, I never knew that. I had no idea. And it was crazy. I went to the doctor for something else completely and I saw the PA. She's like, you donated your kidney? What's it look like? I even had a picture of it and had the doctor take a picture. And she's like, I've never seen one. And it's just amazing how uneducated is the wrong word, but misinformed people are about it. And that's what I've been trying to focus on with my volunteerism is to increase the number of living donors.
Yes. Well,
Yes.
that's great, and programs like this hopefully will help.
Yeah, exactly, to
And
tell your
that's-
friends and to
yeah.
educate your family members and say, hey, just research it. Go read something on it, please, and tell somebody else and put it on your Facebook or your Twitter. Because we did the math the other day, I think just kind of rough math, of if one out of every 20 people in the country would say, hey, I'll donate my kidney, you would remove the waiting list for a kidney in this country.
Yeah, gone.
Pretty
Gone.
Incredible.
And so,
That's good. That's very good, and I'm so excited that here in Hernando County maybe we can get some momentum to move forward,
Yes,
especially
definitely.
if we have one in every 9.
One every night.
One in every
Yes.
9 people. Okay, so this is a great segue to talk a little bit as we come to the end of the show about the Kidney Foundation. Talk a little bit about the affiliation that you have. Is it the Kidney Foundation of Florida?
It's the National Kidney Foundation of Florida.
Okay, talk to us a little bit about that and what it is that you do and what they do, how they stay alive. Talk a little bit about their fundraisers, things like that.
Well, our primary goal is complete patient care, understanding, and education. We raise our funds in multiple ways. We have 7 walks every year throughout the state of Florida. They're all listed on our website. We have 4 golf tournaments. We have different events. On the East Coast, we have a huge surf event every year. All this money that comes in is used for direct patient care, because we have a program called Direct Aid. Direct Aid is used when somebody who's on dialysis or has a transplant that can't get to a dialysis clinic, doesn't have transportation, doesn't have food. It's
Anything.
yeah, the food is the one that really catches you, catches your heart, because these people have to decide between medications, getting to dialysis, or eating, and it's kind of makes you wonder how people who can't really afford to eat can afford to eat right.
Right.
So they're on dialysis, they need to eat right, and basically they don't have the money to eat at all, let alone properly. So we make sure that we have that program to help as much as we can. The problem is there's so many people that unless you raise more and more money, you can't reach all of them. So it's basically a triage method of selecting who gets the help. Also, we have what we call boots on the ground advocacy. A lot of the time when a patient needs something, whether it be a new diagnosis, someone who's been in dialysis for 4 years, and they call somebody outside of us, or any other disease, they get sent, well, what's your problem? And they get sent a catalog, and they get sent something, to read. Well, that doesn't really help people as much as maybe some people think it does. We like to get in front of the people. We like to make sure our phones are available 24/7, that no matter what happens, they can call and get help. It can be anything from I was just diagnosed to I don't know what to do in my clinic, I'm having a tough time, mentally I'm really suffering. And again, we don't disperse medical advice, but we give them hope. Because when they see a patient who went through it, who suffered all the indignities of the disease, monetary, everything that the disease can do to you, went through it, and then see the bounce back, okay? Everything is possible. And they can see that, it's enlightening to them. And we can plug all the volunteers we can get. Okay, that's the only plug, I swear. But it's important that people realize what we have, and they won't know what we have unless they're educated. So I implore everyone, please go to the site, please get any information, please give us a call, please get checked, so you don't have to go through it.
Right.
Most of us have to go through.
Yeah. And after the show and with the 1 o'clock appointment, 1:15 appointment today, I'm going to see about doing one of those screening clinics here
Excellent.
in Hernando. That
Good.
would be awesome.
Good.
And we only have one dialysis center that I know of here in Hernando County. Am I correct, just one?
I've got a list for you.
Oh, okay, great. Well, I'm sure they are very supportive of community education, making people aware of donation, transplantation, prevention, things like that. So it's been really fascinating. Is there anything else maybe that we forgot that you need to?
I just want to add one thing about dialysis. Because a lot of Hernando is a rural location, you don't have to do dialysis in a clinic. You can do it at home.
Right.
You can be trained to do it at home either way. So don't let that say, oh, I got to travel 60 miles to go to Spring Hill or to go wherever. You don't have to do that. You can be trained, get treatment in the relaxation of your own house. If you choose peritoneal, you can do it while you're sleeping. So there's a lot of positive aspects to the type of treatments available.
Okay, that's good to know. A lot of hope for people today.
Oh, yeah.
I love the share a spare. That
Yeah.
was
Share your
very
spare,
good.
yes.
Share your spare. That's
Yes.
good. I wish I could share some other
And
spare
don't take
that
your organs to heaven. Heaven
Yeah.
knows they don't need that we need them here.
Don't take your
And it's-
organs to heaven.
And it-
Okay.
yep, and it doesn't stop you. I've recently found out another thing that even donating your kidney doesn't discourage you from other things, because I found out it's kind of off topic, but before I donated, I had signed up for the bone marrow registry. I got a phone call last week that they said, "Hey, we think you're a match for somebody for your bone marrow," and I'm going through the testing now to donate that.
Yeah,
So
so
it's-
yeah.
yeah, you
Boy,
can-
you're a good soul. Why don't you move to Hernando County? It's lovely here.
Well,
We-
I am here as much as we can, as much as I can be to help. And as with Joe and with his boots on the ground advocacy for patients, it's also contact the National Kidney Foundation of Florida. And my wife works there now after the donation, and she'll put you in touch with me if you want to be a donor, or if you are a donor and have questions or going to be a donor. It's the same way. Just
Yeah.
the goal is to educate people and help as much as we can.
Yes.
So.
Well, excellent. Well, it has been truly a pleasure talking with both of you, and I am in awe of what you do, and we very much appreciate your presence in Hernando County.
Thanks
Thank
for
you.
having us.
Thank you.
Thank you for joining us today. I hope that you got as much out of this as I did. I really learned a lot. I hope you'll come back and join us another time. Again, my name is Ann Gale Ellis. I'm with the Department of Health here in Hernando County, and we thank you for joining us for Healthy Hernando.